check that you have the right patient, all that good stuff. And then position the patient. Okay, so first thing with the abdomen, of course, the way we're going to do the assessment is different. We're doing inspection, we're doing auscultation, we're doing percussion, we're doing palpation last. So with inspection, you're inspecting the symmetry and the contour of the abdomen. This abdomen is slightly rounded. Symmetry side to side is the same. You're noticing the umbilicus, whether it's inverted or everted, and checking to see if there's any herniation, if it's an everted umbilicus. The hair distribution for a male is a diamond, for a female inverted triangle. And just noticing the skin itself to determine the color, the quality of the skin, if it's tense or if it's stretched, and if there's any lesions or any obvious masses. You're also going to notice any pulsations in the abdomen, and again, you need to sort of get down at eye level to see if you see any pulsations in the epigastric or the umbilical or suprapubic regions, and there is no pulsation, so that's a normal finding. So then you're going to go on to auscultate the abdomen, and you're going to always start in the right lower quadrant over the cecum, because there will always be bowel sounds there, and just listen for bowel sounds. And moving the stethoscope a couple of places in each quadrant to pick up whether there are bowel sounds or not. And the bowel sounds sound normal. Then I'm going to listen to the great vessels of the abdomen. So I know that the bifurcation of the aorta is at the umbilicus. So I'm going to listen to the aorta first, and I'm listening for a bruit or a venous hum. I'm going to listen to the renal arteries. I'm going to listen to the aortic arteries. Iliac, yep, thank you. And then finally the femoral arteries. And I don't hear any bruit or venous hum, although a venous hum is perfectly normal. Bruit indicates turbulent blood flow, which may indicate some obstruction in the vessel itself. Moving on, then I'm going to do percussion, and I'm going to percuss starting in the same right lower quadrant. Two or three percussion points in each quadrant. And percussion should be general tympany throughout. Then we're going to percuss the liver borders. So I'm going to start at about the third intercostal space. I know that the top of the liver is going to be about the fifth intercostal space, and I know the bottom of the liver is going to be about the costal margin. So I'm going to start about the third intercostal space and percuss down. I'm anticipating dull at about the fifth intercostal space, although I mark that with my eye. That's my superior border. To find the inferior border, I'm going to start in the abdomen and work up. Tympany, 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 dull at the costal margin. And I'm going to measure that, and it should be 6 to 12 centimeters. To percuss the spleen, I'm going to go mid-axillary line. I know the spleen lies at about the 9th to the 11th intercostal space. So I'm going to start about 7th intercostal space and percuss down. So I'm percussing down mid-axillary line to the 9th intercostal space where I find dull. I want to find the lower border of the spleen, so I'm just going to keep percussing down. Dull, 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 dull. Tympany. I found the lower border of the spleen. Now I know the spleen lies towards the back, towards the posterior aspect of the thoracic cage, so when I move my finger up to the anterior line, I should definitely still have tympany. I'm going to ask the person to take a deep breath, and I'm going to continue to percuss. And I should have tympany. Unless the liver is 2 to 3 its normal size, then I might have dull. So it's a significant enlargement with the liver in that case.
Spleen.
We will percuss the kidneys. Now, this is where I said you would have a live person for the kidney percussion. So you've got to find that costovertebral angle and put your hand over it. Tell me if there's any pain. Palpate that costovertebral angle. Any pain? Okay. On then to palpation with finger pads. You're going to palpate in 2 to 3 areas in each quadrant, starting at the right lower quadrant again, lifting up between each palpation, not dragging your fingers. Thinking about what the organs are that are underlying the areas that you're palpating. And I don't feel any masses or lesions. I'm now going to palpate the liver, so I'm going to use the hooking technique. So I put my fingers under the intercostal, excuse me, the costal margin. Ask the person to take a deep breath. I should feel a fish fin or nothing. Excuse me. I'm doing this again for you. For the spleen, oh, here we go. I'm going to raise the thoracic cage with one hand, with my other hand, pointing at the axilla, under the costal margin. I'm going to push. I'm going to ask the person to take a deep breath. If I feel anything, excuse me, the spleen is enlarged. A normal finding is you don't feel anything. Palpating the kidneys, duckbill technique. On each side, I'm squeezing my hands together, asking the person if they feel any pain or discomfort, and feeling myself if I can feel anything, any masses. And I don't. And the same on the other side. Okay. And and I don't feel anything. And that's it. What's the time?